If you've been told you have flat back syndrome, which is also called straightening of the lumbar spine, this video is for you. Most people are told to stretch or strengthen their core. But if you're missing your lumbar curve in your lower back, stretching and strengthening alone won't be effective. In this video, I'll walk you through 4 specific at-home exercise progressions designed to target flat back syndrome, also known as straightening of the lumbar spine. This exercise program will help you begin to restore your normal lumbar lordosis safely. We'll start with gentle, floor-based movements, progress towards upright positions, and I'll even show you how to choose the right level so you're not pushing too far. And if you watch to the end, I'll show you a home lumbar spine orthotic that we prescribe to our patients that provides gentle, at-home lumbar traction. This home traction plays a key role in helping a straightened lumbar spine return towards its normal curve. I'm Dr. Graham Jenkins, a corrective care chiropractor in Kelowna, British Columbia. Our clinic is one of only 2 clinics on the west coast of Canada that is advanced certified in Chiropractic BioPhysics, and we help patients restore their health, mobility, and confidence through non-surgical spinal rehabilitation. I'm one of only a few doctors in the world who are advanced certified in Chiropractic BioPhysics. My mission is simple: to help people live strong, active, and pain-free lives for as long as possible. I do that by focusing on real correction, not just pain relief, helping people fix the root cause of spine problems that have held them back for years. On this channel, you'll find clear, evidence-based videos that explain how your spine and nervous system work, why posture matters, and what you can do to move and feel better naturally. So if you're ready to take control of your health and start moving without fear again, subscribe to the channel. You'll discover practical, evidence-based ways to correct your posture, protect your spine, and keep your body strong for life. I upload a new video every week. Before we get into the exercises to improve a straightened lumbar spine, I want to take a minute to explain what a normal lumbar curve is supposed to look like. From the side, a healthy lower back is shaped like an elliptical curve, and that curve is deepest in the lower segments, especially around L4, L5, and L5 and S1. That shape is important because it helps spread the weight of your body evenly across the lumbar spine and the lumbar spinal discs, instead of loading one area too much. When that curve starts to flatten, straighten, or reverse, which is what we call straightening of the lumbar spine or flat back syndrome, the spine doesn't handle load the way it should. That load can be from moving and lifting, or it could be as simple as the gravitational load from sitting in your office chair. Over time, this can lead to more than just stiffness or soreness. Extra stress gets placed on the discs, which can contribute to disc bulges, disc herniations, and early degenerative changes. As that stress builds, the joints in the lower back become irritated and cause local pain. And if the spinal nerves get involved, symptoms can start to travel into the hips or down the legs. The important thing to understand is that unless this is addressed with the right corrective exercises and traction-based approaches, it usually doesn't go away on its own. And that's exactly what I'm going to show you next. 4 specific exercises that help improve the straightening of the lumbar spine. We'll move through them in progressions, starting with very gentle options and working up from there, so you can choose what feels appropriate for your body. So let's get started. So this is how Jenny is laying here. So we are working to restore the lumbar lordosis. So if we've got a flattening of that curve, you'll see that a lot of our exercises are all about restoring that curve in the lumbar spine. Okay, so the first set of progressions that we're going to do, really simple. So she's already doing the first progression here from being flat on her face. So just that little bit of a lift, we're getting the rib cage above the lower spine. And it's not so much repetitions for this, it's time. So when somebody comes in and they've got a flat back and there's a lot of muscle spasm in there, we will have them go into this position for 5 minutes. Now, they're not going to start out at 5 minutes. They might only be at 60 seconds or 2 minutes, but eventually we will want to get them doing this at least once a day for 5 minutes. Now, most people should be able to progress through these 4 different levels fairly quickly. Progression number 2, and again, same idea, 5 minutes a day is what we're going for. We're going to have her come up to her elbows. Good. So what you can see here is we've increased that lumbar lordosis. So if you remember on our model, that flattened lumbar spine, we're getting more curve in that lower spine. We really want to have people relax their abdominal muscles so that the more of the curve actually comes in the bottom half, so that L4, L5, and L5S1, like we talked about earlier in the video, being that portion of the ellipse. So there's more curve on the bottom half. The next level, again, so this would be 5 minutes a day, getting more curve. Next level, she would actually come up with her arms straight. Now this is where we're getting into quite a bit more extension. So this is where it's getting serious. People are probably not going to be able to do 5 minutes day 1 on this. And then the last one is that pure cobra. So we're actually getting her to extend up like in the yoga positions, and we're really pushing and holding, again, relaxing the abdominal musculature, so we're getting more curve on the bottom half of the lumbar spine. Are you feeling that, Jenny? Yeah, and Jenny's super fit, so even this progression is more significant, and we're going to get more curve in that lumbar spine, so you can relax down. Okay, so now we're progressing on to exercise number 2. But before that, I just want to mention a little bit about the difference between the exercise number 1 and what we're now moving into we call Blackburns. So exercise number 1 is about mobility and getting ligament stretch. So it's a bit more of a motion-based activity. This is more strengthening. So Blackburns progress into 3 progressions. So the first one we're going to do is called the Blackburn eye. Just think of a big, gigantic eye. Jenny's got her body in the shape of an eye here, and we're going to extend up. So we're going to lift nice and gently. We're going to lift nice and gently. We're going to do about a 3 count, 3, 2, 1, and then relax. Okay. We do that again. 3, 2, 1. And relax. Good. And because we're working postural stabilizers, they're not really going to respond to 3, 4, 5 reps. We need to go 12 to 18 reps to get the postural stabilizers to change. They are built for holding you 24/7, 365, or actually just when you're under gravity. So we need to work those more reps rather than less. So it's body weight, but more reps. So 12 to 18 before we progress on to the next one. So Blackburn eye is with the arms straight up. Now we're going to progress to Blackburn T. So we basically, Jenny's going to make her body into a T, okay? And if we can have her rotate her thumbs to the sky, it really does isolate it. So it's a harder exercise. So Jenny, if you could come back up for a count of 3. 3, 2, 1, and relax. You doing okay? Okay, and one more time. 3, 2, 1, and relax. And finally, the last one is an A-frame. So she's going to bring her arms down by her side. Again, rotate the thumbs to the ceiling and go ahead and do that. Bring that up. 3, 2, 1, and relax. And let's do it one more time, just to show people how fit you are. 3, 2, 1, and relax. Awesome. Okay, you can relax. Now, did you notice, Jenny, the progression yourself? Like, did they get harder, or what do you think? Yeah. Okay. So give yourself a break on this. That Blackburn A it's a really hard exercise, especially when we're talking 12 to 18 repetitions. That's a lot. Like, you will really feel those muscles burn. But definitely the difference between exercise 1 and exercise 2 here, the Blackburns, is this is more of a strengthening exercise, whereas the stretching is more of a tractioning, getting more ligament stretch in there. And that's why you hold for a long period of time, because ligaments need stretch over time or load over time to be able to change their structure and restore that curve. Okay, so this next exercise, I'm going to show you on Jenny, and then we'll talk about how you can practically do it at home. So what we've got is an exercise band, and you should be able to pick that up at most of your exercise or your fitness places. You could probably even find something like this on Amazon, likely, right? Okay, so what we've done is we've wrapped it around her lower back. You can see here on the difference between the black and the green here. And what we're going to do is, when I show you how to set this up, you're going to loop this around something fairly firm. So we've got a few devices in the office that we have lots of access to, but you know, if you're in a gym, or if you have access to a big cage, like a weightlifting cage, you could just put it on the bottom and attach it, loop it through in the bottom, and I'll show you how to do that. But for the most part, what you're going to be doing is, if you're doing this on your own, then you're scooching back from where you've got it tethered. Now, I'm going to do that work for Jenny. So what she's going to do is she's going to let her lumbar spine, she's just going to let her lumbar spine dump into a nice curve. So not so much leaning back, but just there you go. Yeah. So you kind of let it go, and you can feel, do you feel that pull on that lower spine? So this is a kind of traction that you can do on your own. I'd still like her a little bit more upright based on what I'm seeing on the camera there. So come a little bit forward and just let it get really lazy in your lower back. And you can see if this was attached and you were scooching back, you could get quite a bit of pull. And now this, again, like in our first exercise, we're going to hold that for 5 minutes. So we're going to get you in that position, and you're really going to let that stretch. For a lot of people, if you've got some disc issues or anything like that, you might find a lot of relief with that. So you could go upwards of 12 to even 15 minutes with this, as long as you don't kind of arch the back. If you keep it nice and upright and just let that lower back dump. So the next thing I'm going to show you is how you might want to attach that to something to get that kind of leverage. But this is a really good, it almost approximates some of the traction setups that we have in our office. So you can really feel that, especially if you've got a nice big thick band like this. These come in different colors. So the thicker, kind of heavier, is going to be more effective down in that lower spine. See here, I've got this band attached, and I'm just scooching back, but I'm really letting my belly kind of go forward there. And I'm just letting the band do the work. And the further you come back away from wherever your band is attached, especially if you got a nice big thick one, you'll get more lumbar lordosis established. And like I said, if you do have some disc issues, dealing with a slight bulge, then a lot of times this can just give a little bit of relief, because we're opening up those disc spaces and providing some gentle traction. So 5 minutes, if we're just working on increasing your curve. If you want to go up to the 12 or 15, you're not going to cause any damage. Just gives you a nice big stretch. Okay, now this next one is your weight bearing. So we get that activation of the muscles. So this is really good to retrain your body on how to hold that new lumbar lordosis, or that increased lumbar lordosis. So it's called a wall push-up. So what Jenny's going to do is she's going to really let her lower back just get really super lazy. Right? There we go. And then she's going to keep that pelvis as close to the wall as possible. And then she's going to do that push-up. So go ahead. Okay. All right. No. We're going to go back in again. There we go. This isn't an easy one, guys. So just keep that in there. Okay. So just push. I'm going to keep my hand in there so you don't, you feel that build? Okay, yeah. So it's not this big gigantic motion. You don't want to let the pelvis come back, because you're basically losing the curve. So that's your standing, increasing the lumbar lordosis. In addition to these 4 exercises for improving the lumbar curve and reducing a straightening of the lumbar spine, a true structural rehabilitation program isn't complete without 2 additional components. The first is mirror image adjustments, which we perform in the office. The second is mirror image traction, which we also do in the office and then prescribe for patients to continue at home. This 3-pronged approach is the foundation of chiropractic biophysics. 1. Mirror image exercises, which you just learned. 2. Mirror image adjustments. 3. Mirror image traction. Together, these address the problem structurally, not just symptomatically. And what I want to show you next is the home traction spine orthotic we recommend and prescribe to our patients to help improve lumbar lordosis. This is called a lumbar Denneroll spine orthotic. You'll notice it has a higher peak here, and that's by design. When this is placed under the lower back, it specifically targets the lower lumbar sections, especially L4-5 and L5-S1, which is where a normal lumbar curve should be deepest. As a patient lies on the floor with this positioned under the spine, their body weight creates a 3-point bending effect that gently introduces a lordosis in a spine that is straightened. Depending on the size of the individual, we have larger lumbar Dennerolls. This is a medium, and this is a large. Sometimes it's not necessarily the size of the individual, but their flexibility as well. So if I have a super flexible patient, they're going to be prescribed a large versus somebody who's more rigid, they're going to be prescribed this smaller yellow Denneroll. These Dennerolls help recreate the normal lumbar shape, which is deeper in the lower segments and naturally flatter in the upper segments. We typically have patients start with 2 to 3 minutes at home and then gradually increase by 1 to 2 minutes per day, working up to a maximum of about 20 minutes, as long as it's well tolerated. And this is always done after the lumbar extension exercises you just saw. We want to warm up the tissue. The goal of the lumbar Denneroll is not just stretching the spine. The goal is to create positive, long-term change in the ligament structures that have been adapted to the spine being held in the wrong position when the lumbar curve is reduced. Over time, this traction helps remodel those tissues in the correct direction towards a normal lumbar lordosis. The goal is to create positive, long-term changes to the ligament structures that have adapted to the spine being held in the wrong position when the lumbar curve is reduced. Over time, this traction helps remodel those tissues in the correct direction towards a normal lumbar lordosis. This is the goal of lumbar extension traction, and it's also research-based. Studies using chiropractic biophysics methods have shown that lumbar extension traction with devices like the Denneroll can increase lumbar lordosis by approximately 7 to 11 degrees over a 10 to 12 week period. In those studies, patients who received standard care alone didn't regain their lumbar curvature. Follow-up research has also demonstrated that when curve correction is achieved through traction-based approaches, these improvements can be maintained at 6 months and even beyond 1 year, along with improvements in pain, function, and overall spinal stability. This is why lumbar extension traction is a core part of correcting a straightened lumbar spine. It provides a measurable, repeatable way to help restore the lumbar curve, rather than simply managing symptoms. When this traction work is combined with the exercises, patients are not just exercising their back in the right direction, they're also creating the conditions needed for more permanent structural improvement of the lumbar spine. The goal of this video was simple: to give you specific exercises that directly target and help improve a straightening of the lumbar spine. You can see how these exercises play an important role in a structural corrective care program, not just symptom management. You also learned about the home lumbar spine orthotic and how it's used to create structural changes in the lumbar spine, help restore lumbar lordosis, and why this approach is supported by sound research from Chiropractic BioPhysics. If you've been told you have a straightening of the lumbar spine, give these exercises a try and let me know how they work for you in the comments below. I read and respond to every comment. If you found value in this video, like it and share it so other people dealing with flat back or a straightened lumbar spine can also benefit as well. And be sure to subscribe to the channel because in upcoming videos, I'll go into more detail on how we correct straightening of the lumbar spine using in-office traction and corrective care protocols. And if you want to dive deeper into understanding straightening of the lumbar spine, go ahead and watch this video next.